So hi, I'm Dr. Camille Guzel. I'm a physical medicine and rehabilitation specialist, and I'm one of the electrodiagnosticians here at UCSF. A lot of people are asking questions about what to expect with an electrodiagnostic study, and I'm here to help demystify it and answer your questions ahead of your visit. Electrodiagnostic studies consist of two parts. One is the nerve conduction study, and the second is the needle electromyography. The nerve conduction study is a minimally invasive part to test the nerves and how your nerves carry signals throughout your arms. The study can be done on an arm or a leg. Nerve conduction study is non-invasive, so I place stickers on the limb of interest, measure things out, and at very specific sites, put a small electrical stimulus through. It feels a bit like a snapping rubber band, and I always see how big and how fast that signal travels through. That gives us information about the health of your nerves. Is it uncomfortable? I think it's a more surprising than uncomfortable, but everyone experiences a little different way. If at any point it's too intense, let me know. We can change it up how to make your comfort a priority. The second part of the study is the needle electromyography. Like the name implies, there is a needle. It's minimally invasive, minimal risk. There's no electrical stimulations. What we do with this electrode pen is we go through the skin into different muscles up and down the limb of interest and even into the back. And we have you contract those muscles in very specific ways and very small contractions. That way, we'll be able to have the flow of your own electricity come through the nerves and into the muscles. And we take a listen, literally a listen. You too can hear the snap, crackle, and pop of your own electricity. The combination of the nerve conduction study and the needle electromyography gives us a lot of information to diagnose if there's any pinch points of the nerves across the length of the limb from where the nerves exit the spine all the way down. We do this on both arms and legs, depending on the clinical question. Electrodiagnostic studies, we are diagnostic. We're in the business of information gathering, providing accurate, reproducible information about the health of your muscles and nerves to be able to share with your referring provider so that you and that physician can make more informed decisions. So that said, information gathering only. I do not want this test to be worse than your symptoms itself. A lot of people may have anxiety about what to expect when they hear shocks and needles. Trust me, I've done it to myself and had it done many times. It's uncomfortable, but not intolerable. What to wear to the study? First of all, we have gowns and shorts if you do need to change. If you do want to wear clothes that are more easily accessible for the study, if it is an upper extremity study or an arm study, I need access to all the way up to your shoulder and the back of your neck. So a tank top often is great for this. Wear a sweater so you don't get too cold. For a lower extremity study, I'll need access to your whole leg up to about mid-thigh. So often people wear shorts, or we can provide some shorts in the clinic for you. How long does it take? Expect to spend about an hour together. It is a fairly extensive study. Sometimes it will be a little shorter. For more complicated questions or studies that have two limbs involved, we might take more like an hour and a half, just so you can budget your time at clinic accordingly. Are there any activity restrictions? There's no formal activity restrictions afterwards. You can do all the things you normally would do. We do ask for infection prevention. I recommend avoiding soaking the needled sites for a day or two. Showers are okay. I'm talking hot tubs or swimming pools to reduce the risk of infection. Overall, this procedure carries very minimal risk. So I will look forward to partnering with you for electrodiagnostic studies to be able to get you and your referring physicians the right data, accurate, reproducible data about the health of your nerves and muscles so that you can make informed decisions about your plan of care.